Good day. The world is grappling with an unprecedented pandemic. As of today, 1,176,013 cases have been declared worldwide, with 64,324 deaths. Italy still tops the chart with the number of people killed by the coronavirus, 15,362. But the United States of America has the highest number of infected cases. They have 312,223,000 people who have been infected by the disease. The African continent is still coming up strong. The situation in Cameroon is still preoccupying. Last week we had about 292 cases, but today we have 555 cases already declared in Cameroon. So it's an emergency and everybody must be on their mark. We have quite a good panel on the program today to handle the situation which we have. What should Cameroonians do extra which they have not been able to do? And what is the scientific world in Cameroon doing? We have so many questions about the use of lemon, garlic, and what have you. Yet, our scientists have not made a statement on it. We are hearing about treatment. People have been cured. What are they saying about it? They are here with us on the program this midday. We have an experienced journalist with us, Franklin Sonebayen. You're welcome to Press Eye this midday.
Pleasure to be here again.
Quite some time you haven't been with us on the program, but it's good we have you on the program today. We have Dr. Eric Tandy. He's quite a familiar face now, given the ongoing pandemic. You're welcome.
Thank you very much.
What's new? I should ask.
What is new definitely is the increasing number of cases, of confirmed cases that we have.
We'll come to that. We have a member of the Cameroon Research World. He is the second vice president of the Cameroon Academy of Sciences, or how do you put it? The Scientific Council for Emergency Health. Am I right?
So this is the right name is the Scientific Council to support emergency management in Cameroon.
Okay. He is Professor Pierre Ongolo-Zogo. You're welcome.
Thank you for having me.
And we have an epidemiologist. These are people who manage the diseases like what we have here in Cameroon today. Dr. Felix Assa, you're welcome.
Thank you.
And when you hear people talk about a pandemic, it means that it has moved out of an epidemic to something else, which has a bigger coverage in terms of the attack.
Yes, actually, when you talk of a pandemic, by WHO standards, it means that it's an epidemic which has moved across multiple regions of the world already. So an epidemic being the fact that you see a new disease in the population which is usually not there, or the numbers are different from what you would have in ordinary times. So a pandemic is because now all regions of the world are involved. Over 190 different countries have been touched.
Okay.
So it's really a serious public health emergency.
Okay. A public health emergency, and that's why the government has all its hands on deck. The Prime Minister the other day held a teleconference to be able to handle the issue working from home and using technology to do that. Almost every structure in the country is bent on that. What have you noticed about the disease or the virus, Franklin?
Yeah, I'm coming from they are the experts and the scientific experts, the natural science experts. I am the social science expert here. Public affairs,
the keen observer.
Yeah, the public affairs, social issues and stuff. I think this is one pandemic where I haven't lived 100 years. I don't know what happened in the previous centuries. We can only read, but I'm living something I never expected to see. Especially we've had other pandemics, other epidemics, and other pandemics that struck the poorest countries. And we thought there were issues of poverty. Now we're seeing one that is defying all the rules. It's attacking the richest countries more than the poorer countries. And it looks like we used to think that money could do everything and knowledge could do everything. It looks like this one is putting shame on money and knowledge. It's unprecedented.
Okay, an unprecedented pandemic, and people are dying in their numbers, and it's not yet over. I don't know what the future holds. No one knows except God. Now, how would you assess the preventive methods on the way in the country now? Dr. Tandy.
Yeah, thank you very much, Joe. I think we have to start thinking more beyond the prescribed preventive measures or measures that have been put in place by the government. Because I still get very worried the way the population behaves, especially in our market squares and shopping malls. Although these preventive measures have been prescribed, but yet the population still behave indifferent. It makes me to get worried if they don't get the information that is being disseminated on the various media organs in the country, and even for those who have been sent to the field for campaign. But we have to continue with sensitization campaigns so that they get the information right and know that the COVID-19 is real within our community. You
talked of we have to go beyond the preventive measures. What was in your mind when you said that?
Yeah, actually you saw like the few weeks the Minister of Public Health has embarked on an offensive method. It means that we now move to the community to do what we call massive testing of the population in order to identify cases within the community so that we could curb or put an end to the disease within a shorter range.
Now, when the minister is moving, is he targeting a town, targeting a population, targeting a locality, or why is he going towards a specific area?
Yeah, you know, like when the issue started, when we start noticing the cases within our community, Yaoundé and Douala was the two regions that we've noticed this. And we know how populated these regions are within our country. So the approach was to start within the Douala city and also in Yaoundé city, because we observe that the number of cases we're having have been much more identified within these communities.
Now, there were so many calls earlier on for the government to move further in its preventive approach to maybe coercive approach to get people adhere, even force people to wear masks or force people to stay at home. Have you been considering that yet?
Yeah, you know, the issue of actually putting pressure on the population to adhere to certain conditions is what we call discipline. We only have, I think, even on this panel, we've explained many times that we are more concerned about the discipline of Cameroonian population, despite the repeated calls for people that we should stay at home or the population should stay at home. We now came up with a revision, or the Minister of Health said, but if you must go out, try to respect social distancing and equally take on a face mask, because we don't know who you can meet on your way.
Now, Professor Pierre Ngolo-Zogo, you've just followed him talk about these putting on a face mask or staying at home. This is optional because the government has not put a restriction on or a penalty for those who don't carry face mask or don't stay at home. I remember I was watching a video, and in Hong Kong, almost everybody has a face mask on. And you know that Hong Kong is next door to China, but as of now, less than 700 people have been confirmed of that disease in Hong Kong. Should we say that government should use a stronger method to be able to get people to adhere to some of the prescriptions which they have on the table?
Thank you, Joe, for the question. I wanted to make a preliminary comment.
Okay, you're free.
This disease is actually teaching us a lot about how we should deal with globalization and how we should continue to feel free, but how we should also organize ourselves as society or communities. When it comes to disease, it's at the beginning an individual issue.
Okay.
But when it's about infectious disease, it becomes a community issue. And what we have learned from the Ebola virus disease outbreak in West Africa is that definitely we need to have an integrated approach because this epidemic or this pandemic is actually challenging or threatening the whole economy, be it local, national, or the inter-country, international trade. So we need, as scientists, as government, to have an integrated approach. That is trying to put science at the heart of national policies. It's not just about biomedicine. It's also about social science. It's about understanding our communities. So definitely, while we commend the scientific council in place, we need to go beyond to integrate that. If we continue just establishing rules or measure or coercion, we can run towards a human catastrophe, because without the local economy operating, then people will start dying for other reasons, for malnutrition, for other diseases not being taken care of in health facilities. This being said, what we've learned is that this fight should be a local fight, even if it's a national fight. It has to start from the family, then the community, then the municipality, then the division, the region, and then the national. We need to combine bottom-up approaches with top-down approaches, where the central level is providing the means and the knowledge so that people can contextualize the fight. Looking at what has happened in some of the countries, learning from China, China has been able to cross the curve in less than 10 weeks. Can we get there? Yes, we can get there, but we need to structure our fight building on national intelligence, building on what our tradition tells us, but how our society is also organized. It has to be a community fight. Okay. It's not a government fight only. It has to be owned by the community at the very grassroots.
Yes. Now, what would you prescribe as a measure which the community has to implement to be able to get that bottom-up approach to government to help them implement that fight?
Let's start by hand hygiene, the WASH strategy, water and sanitation and hand hygiene. The central government cannot achieve this. This is a fight starting from the household, then to the community. Regulating use of marketplace or public transportation, it can be handled from the central level. It has to be negotiated. It has to be designed and crafted at the very local level. Because at the end of the day, it's about resilience of a nation, resilience of community. So what I'm trying to push forward there is that it shouldn't be considered to be the only issue of the Ministry of Health. It has to be a global fight, but locally
with local realities. Now,
local realities informed by science. This is critical. It shouldn't just be coercion. It has to be grounded into what is known on social behavior in our communities.
Okay, I'll come to you shortly. There are some intriguing questions in my mind concerning what you're doing. As an epidemiologist, when you look at the situation in Cameroon and the situation on the African continent, he just talked about cross or interstate cooperation, but it has gotten to a point where each state has to, first of all, deal with the issue frontally as they see it before they begin to call on others, right?
Yes, effectively, Joe. I think the pandemic started out, and because it's a new virus, people got scared and there was panic. And that's why you'd find countries rushing to close borders, but which proved not to be effective because the virus has effectively traveled around the world, despite the fact that borders were closed, airports were shut.
But you did not recommend the closure of borders?
With the current context of the world and globalization, how effective can you close a border? It's going to be very difficult to close the borders because somehow people are going to come in, either by land borders or sea borders or otherwise.
But you limit, you limit the movement at least.
Yes, but now when you limit the movement, and that is what we are seeing with the SARS-CoV-2, which is a virus which causes the current COVID-19 pandemic, the spread is really rapid. And we have not yet understood the dynamics of transmission. When do you start transmitting the virus? When do you become infectious? And it appears that people actually could become infectious to others without any symptoms. So closing the borders or trying to screen only for people who are symptomatic may not be effective. But it's a pandemic that has taken the world unawares because it's a new virus, it's behaving newly. And scientists are not sleeping. They are struggling to study this virus, to understand how it is moving in the community. How is it moving in the community? How is it transmitted? People are worried about all sorts of things. I'm sure you would have seen some videos about people washing streets.
Yes.
Yeah. So it's because...
That was in Bamenda.
Good.
Because people spit and people throw all sorts of things on the streets.
Yeah,
so if the virus can lie on the surface like this one, why not on the streets?
So you see, it's because it's a new virus. We are still trying to understand this virus, how it behaves. You know, a virus is not classically a living organism. It's a biological organism, but it's not living. It needs to get into a cell before it starts living. So the virus can lay on a surface and still be capable or still be viable to infect a cell and then start.
So you would discourage the washing of streets?
No, you need proof to show that washing the streets, that is where the virus is lying.
Because if the virus... Since you don't know where the virus is, isn't it you do everything possible to eliminate it wherever it is?
That's what I'm saying, that it's a response to panic. Because the virus does not remain viable forever. Simply by exposing the virus to the sun on a particular surface. For example, on cardboard surfaces, the virus can only live for a maximum of 24 hours from studies that have been done in the United States. Meanwhile, it can live for up to 3 days on metal surfaces. So when prescriptions for hygiene are given to the public, it is based on those facts which are found from studies. And that's why the WHO would say, wash hands, clean doorknobs, clean your taps, those surfaces where the virus can stay, and you are likely to touch that surface. Now, how likely are you to touch the street? Because this virus is
But you
airborne.
walk on the street into your house.
Yeah, but this virus is principally airborne. For now, we know that the transmission is mainly airborne.
Airborne?
Mainly airborne.
So I want to contradict. Yeah. There was a paper published yesterday by gastroenterologists in India that demonstrate that actually our shoes can actually bring the virus into our house, as well as there is a heavy elimination of the virus in the tools. Mm-hmm. So definitely the issue around sanitation is becoming a critical issue. So in China, we have the proof that by what they've done on street, as well as the mask, has helped reducing the amount of virus that
because they were disinfecting streets.
Yes,
for sure. We saw that on television.
For sure, because when people spit down, then this will actually become in aerosols and droplets.
And they spit a lot in China.
So these are some of the aspects.
I was not saying that you should not disinfect the streets. I'm saying you should start with the measures that have the most impact. And what are those measures? Those measures are personal hygiene, washing of hands, sanitizing the hands, coughing into disposable tissue or into your elbow, or maintaining social distancing. Those are measures which predominantly curb to the maximum extent the spread. Then you can go further.
Yes, Dr. Tandy?
Yes, Joe, thank you very much. I'm very happy that Professor Ngolo was able to raise a point that it is a collective effort, and not only collective in the sense that we have to cooperate with others, but beginning from individual homes, meaning you and I need to set, need to set an example by beginning from where you are living and your family. And if a small family could be disciplined, this kind of discipline is being taken into the community, it will give a clinical or a clear flow on how preventive measures could be put in place. I think it is high time we concentrate more on how can we save the population from this issue that is going on. What strategies are more effective?
Okay,
how can the community actually get involved in this?
We'll come to that shortly, but I'll come to you, Doctor. Franklin, when you hear them speak and you watch the behavior of our people on the street, how would you interpret the attitude of Cameroonians vis-à-vis the measures that have been prescribed by government?
I would just want to say something.
Lukewarm?
I'm coming to that. I want to say something first about what they said about how the virus crosses national borders. Was shutting the borders effective and alternative ways of getting in. I think it was just the failure to be proactive. That when people are tested positive, that's not when they contracted it. So people have traveled with it. It takes its 2-week incubation period.
That's good.
So I think that if governments were proactive, that once this virus broke out in China, borders should have been shut. Then we would have succeeded more than we have now in keeping the virus in China, or maybe around China, or maybe have just trickles into other places. By the time borders were being shut, and when Europe was shutting their borders, Africa was still gaping in disbelief. If we had believed that this virus was coming, if Africa had taken the measures that Europe took after it was late, if we had taken it earlier, we would have kept this virus out of here. Now, secondly, about our attitude. I think people are still in disbelief. The kind of disbelief that we had when HIV/AIDS came in the 80s and then into the 90s, and we said it was just a ploy to fool people not to enjoy themselves. And I'm happy I was an early believer, and I told my friends, you begin to believe when you have a neighbor or a brother who has it. I think that's where we are now. Nobody is doubting that there's HIV/AIDS. I think the sooner people believe that we have coronavirus around, we have gone through a stage where we said it was not maybe the black man was immune to the virus. Manu Dibango has died. Pap Diouf has died. Paulus Mabele has died. If we don't know the others, at least we know those three.
A doctor has died in Douala.
Okay, and luckily, the coronavirus is not a statistic. It gives a name to its victims. You know who has died of coronavirus. We came to a stage where we said maybe infection doesn't happen in Africa. So those who have it are those who got it from Europe and came with it. We've had cases of local contamination. So the sooner we get to the reality that we have it around and begin to take the measures that are necessary. The way I see people live, early in the morning you are going to work, you see people under trees drinking palm wine and shouting into each other's faces. You ask yourselves, are these not people in Yaoundé? Are they not listening to the same radio that you listen to? So what would it take for people to believe that it is real and begin to take the measures? You are home, you try to keep kids home, but you allow visitors come home. You don't know where they're coming from. And the kids, of course, are nice because they don't know anything, and they go and embrace. And some of them are taking kisses from people. You don't know what they have brought. I think that I don't know whether the climatic thing is real. I want to believe that
the scientists will say something about that shortly. If this thing came in a dimension that it hits China, Europe, and America, if it hit us that same way, I think more than half of our population will be gone. Because the way I see people live, people don't believe this thing is around. Okay. I'd like us to take a break. We'll come back shortly, and I'd like us to get this report from our reporter who went down to BMRC to look at how people are living in that part of the city of Yaoundé.
To avoid close contact, these neighbors at BMRC in Yaoundé gossip across the hedge, complying with distancing rules. In just a matter of 2 weeks, they've had to rethink their lifestyle, shunning habits that put at risk the rest of the community. Hand-washing regimens are in place. The loss of free movement in the neighborhood is now evident.
We are no more going to the neighbors as before. We are still living with prudence now. If we have any emergencies somewhere outside, we can send somebody, that when somebody is going out, he will go with that mask.
Social distancing measures have led to friction with family members due to the small space in the house. But the gap between neighbors has increased.
The grandchildren are all over me now. I can't run away from them, but visits from my neighbors are rare.
Vanel is having a whole new routine now, staying at home. Go he did anytime and place and distance for any reason. It's a different ball game now. He says his parents have warned him against visiting neighbors.
We are not visiting them, but we are usually playing ball together. Since the school have stopped, we are still playing with other children.
No excuse is good enough for a neighbors come together. Neither party nor friendly gatherings and birthdays. Neighbors stay at least 6 feet apart as they make physical contact and avoid coming too close for comfort. BMRC stands as a good example of a place where social distancing is a reality. In some neighborhoods of Yaoundé, the story is quite different.
Okay, I'd like to begin with the epidemiologist now. We have moved from an epidemic in China to a pandemic, a world disease now. Would you qualify this unprecedented? And if so, why?
I would not say that it's unprecedented. The world has had some pandemics before, like the 1916 Spanish flu, which affected more than a few 100 million people. So it's not new. It's not completely unexpected. Actually, a couple of months back, Bill Gates gave a TED talk and predicted that we could likely have a major pandemic in the near future. I mean, I'm not sure he knew that it would be so soon.
Why don't you think that he knew?
No, because by the fact that we live in a society where, which is becoming more global every day, and we are also interacting with many other organisms. Viruses are not new. There are viruses out there. They multiply every day. They try to get in hosts into animals, that they live in animals, like the famous story of the bats in Yaoundé. So there are viruses and bacteria all around us.
But people have been eating bats over the decades and over the years.
It's a question of time before a particular virus may get smart and mutate to a form where we can infect a human being. So it's just a question of time.
Do you believe in the complicity theory?
Oh, no. That is just propaganda.
Okay.
For some reason. Some people like to spread fear.
Okay.
I don't know, maybe they sell fear and get something out of it. But okay, we live and interact with many other living organisms in the society, in the community, in our environment. And it's just a matter of time some of these viruses transform and then become infective towards man.
Now, why you said earlier on that you've not understood much about the virus yet. Why are people successfully treated, in spite of the fact that you haven't understood much about the virus?
It's a dynamic process, okay? This particular strain of the coronavirus, the SARS-CoV-2, it's very similar to the SARS-CoV, which caused the SARS in the Middle East, in Asia. And it's also fairly similar to the same coronavirus that caused the Middle East respiratory syndrome pandemic some time ago. So it's not completely new, but it has changed its genetic makeup slightly, and it's manifesting new properties. For example, this particular virus is 3 to 4 times more infective. It's 3 to 4 times more easily transmitted from one person to the other than the virus that caused the SARS epidemic. So you see that it's new. It's not entirely unknown, but now, it has properties that are new.
You said something earlier which intrigued me. Is the coronavirus or the COVID-19, is it airborne? Can it be treated? Can it infect somebody? Is it carried by the air?
Effectively. That's the most common means of propagation, airborne, in droplets. When we speak, or especially when like you cough or you sneeze, there are studies from Japan that has shown that the average sneeze has about 100,000 particles or droplets. And these droplets are big enough to carry viruses from one person to the other, and they can move over a significant distance for up to 1 to 2 meters. That's where the prescription about maintaining...
that's where you qualify it as being airborne.
Yeah, because it's propagated in droplets
which are carried by
the air.
Okay. And under normal circumstances, you won't have other airborne diseases, viruses which are moving in the air.
No, these viruses or bacteria, even when they are airborne, they don't stay infective in the air forever.
Okay.
Okay. In ordinary air, the virus may survive just for a few hours, and then would become destroyed and could not be infective anymore. Okay. But in a situation where, let's say, you are in a crowded room and somebody sneezes, so you see that it's easy for those droplets to move across the room, and then
they float around.
They float around. They're very tiny particles, very, very tiny particles. These studies that were done on sneezing and coughing and studying how the droplets move around the room were done with special kind of cameras that could capture very, very tiny particles that you will not see with your eyes.
Okay. All right. Thank you very much, Dr. Asa. Now, what is the scientific world looking for now? A treatment or a vaccine?
The scientific world,
quote and unquote.
Without quote, it has to go from fundamental biomedical research to apply social science. we have to look at it in an integrated manner.
Okay.
So those working in immunology are trying to have a better understanding on the cause of the disease.
Okay.
How, at what time do we have antibodies developed? Are these antibodies actually interaction between the virus and the RNA and how it can interact with other medicines? So yesterday we've heard, for example, that in vitro ivermectin that we've been using to fight against onchocerciasis is actually having antiviral property in vitro. So the same has been demonstrated for chloroquine, and people are looking at other antivirals property of the existing medicine. On the other side, we need to go beyond and look at the socioeconomic consequences and look at strategy that would actually help curving the issue. We need to look at health service research as well. How do we engage the community so that they can own the fight against the COVID, but also looking at African traditional medicine.
Okay.
There are people also looking at this aspect.
Yes, I was about to come to that because let me cut you there to come in here. We've had a lot of online prescriptions. Take lemon, take fever grass, take this, take warm water. Have you people been able to research to see what can help in the immediate, in that light?
So as the pandemic is entering Cameroon, we will see with our researchers, those who are studying ethno-medicine, what they can actually demonstrate. But we know for a long time that there are several traditional therapy against influenza, against pneumopathy, that people are using traditionally. Mm-hmm. There are papers that were published. There are even in some of the Faculty of Science in Cameroon where people have actually studied what is effective against some of these pulmonary diseases. So these are some of the aspects. Now, nobody has had time to test it in a proper manner in this particular case of the COVID-19. But there are papers, there have been trials in China using Chinese traditional medicine.
And we have more than they have in terms of
in terms of diversity, for sure. So what we are expecting now is actually we are waiting for the result from some of these trials from Chinese medicine, and we expect African researchers working on traditional African medicine to submit proposal, because there is a solidarity fund that is in place to support research, indigenous research from Africa.
Now, are we not running against time?
We have to run against time. This is a pandemic. We have to learn as we implement measures. We have to learn so that we are responsive to any single new information. We need to be proactive.
Exactly.
We need to be proactive. Learning from China, we had this opportunity in Africa that other continent has gone through, and we shouldn't be waiting for solution to come outside of Africa. We need African researchers, be it in social science, in ethnomedicine, in economics, management, to start thinking at solution. I want to put an emphasis here on the fact that we need to be clear that with the informal and informal and formal structure of our economy, we need those specialists in economics to start looking at solutions. Can Cameroon afford food insecurity? What are the consequences of some of the lockdown measures in some of the African countries? Can we afford stopping production in agriculture, or in food, or in health facilities? We need to think at it. And learning from epidemiology, it's critical for us. We now know that we can have 5 different types of individuals within the society. Those who were infected and were cured, these people should go back to work because they are immunized. If science confirms that after developing antibodies, you are actually protected.
Exactly.
We need to know who are those who are at risk being infected so that we can protect them.
Exactly.
We need to know those who are asymptomatic, what are the measures that will prevent them from spreading the disease, who are those who are much at risk or developing severe illness need also to be identified so that we can plan for intensive care management. And finally, we need to start thinking at who are those we definitely need to maintain them, no matter if they are sick and asymptomatic, to continue to run the economy and to continue to run the health facilities. Let's just imagine that we lock down. We'll have a surge of infant mortality, maternal mortality, malaria case, facility rate, obesity, maybe, but if the
for the middle and the upper class,
not even for them, but for the whole society. We've learned this from the Ebola crisis, that during the Ebola crisis, because the health system at the very local level were challenged and measures were not taken, we have surge in other issues, and the death toll was higher, not related directly to infection by Ebola, but because of the failure of the system. So we should learn from this Ebola crisis to start thinking right away on how we create strategies that will mitigate
local adaptive strategies.
For sure. They have to be locally adapted, they have to be locally appropriate. We need local coalition to crush the curve against COVID. This is the only way for Africa to demonstrate its resilience and use this COVID as an opportunity.
Yes, you made mention of something very important there, developing local strategies and the use of local scientists. But one thing which I noticed with African scientists is they don't communicate. And policies seem to have an overbearing impact on the activities and the production and productivity of our scientists.
I just want to disagree on this particular issue.
You have
as a society, researchers in Cameroon are paid by taxpayers in Cameroon, those working in public or private facilities. So the same government is paying for research. The same who are making public policy should make better use of what is being produced by the researchers. Researchers might appear to be individualistic. They are publishing their papers, but if they are not considered to be stakeholders when we have this type of crisis, then they will stay in their lab. This is why we insist, and this is a call across Africa, that we should embed science in the way we are strategizing against COVID. This is the only way for Africa
I see where you're coming
as an
from.
opportunity.
I see where you're coming from. Thank you so much for that pronouncement. Now, Dr. Tandy, you have examined people and you have declared this far that 17 people have been cured. Did you try to see the type of people who were treated of this disease, to see, like he said, are they young people, old people, women, men, those who came in with the disease, and to see how you can, in future, use the approach of those treated to see how to tackle those who are being infected?
Yeah, Joe, it is too early to draw a conclusion on the different types of person that have been treated or that their symptoms have been managed from the COVID-19, because we are still in a course, we are still at the middle of the crisis. So definitely we will be unable to give you a clear analysis on the different sexes or the different age range of the individuals as far as that is concerned for now. But what is very clear is that those who have been declared free from it, that are 17, as we rightly said, all their symptoms have been well managed and they have been retested to prove negative.
Okay. Do you see this stigmatization coming to play among those who are being called upon to come out and talk, or come out and declare, or go for testing?
You know, I wonder why COVID-19 should be something that stigmatizes people. There isn't any evidence that it has, even though we know that exposing ourselves to the risk, we could get infected. But I do not know that it is a lifestyle thing. There is no evidence that it's those who go to nightclub or those who go to bars. Like Dr. Asa said, you can breathe it in the air when somebody sneezes. So there is nothing to stigmatize you about it. HIV/AIDS was something to stigmatize because though there were other ways to get it, I think one of the major ways was through sexual deviance. So you could say that they would say, yeah, now you carry on for head, you know? So I don't know why people should be stigmatized if they have COVID-19. It's something that is such a big risk that people should come out and save others from the trouble. But I want to say something else, Joe. You've asked the question about the local things that we've been advised to use. The lemon, the fever grass, and all the like. I don't know whether the scientists answered that question.
He did.
I do not know that those things are harmful in any way.
The epidemiologist would say something.
We consume even when we are not sick. We consume them. We take hot water with fever grass. We take hot water with garlic. And I understand that some of them have antibiotic properties. I would think that people should consume them. We would not wait for Europe to tell us that it is good, because for one thing, I noticed that the scientific community is very confused. They are so confused that sometimes I hear as far afield as Europe and America that you should wear a mask only when you suspect that someone near you is sick or when you are sick, and that normally you shouldn't carry it. But when I hear what Dr. Asa says, it means that at all times we should wear the mask because you don't know when somebody is going to spray the virus in the air. I think that in times when you are confused, maximum precaution is the best way to go. You don't wait until disaster has happened, then you begin to take those measures. Masks are not available. You go around town, you can't find them easily. But I think for those who have them, I think the best thing to do is wear them as often as possible wherever you go.
Okay.
I just wanted to take on this. Using face shield, using cotton, it's helpful because it helps people to avoid spreading the droplets in the air. This will be beneficial as a complement to the hand hygiene measure. I wanted to point out what we've learned from social science. The fear, the perception of risk, as well as the social stigma are part of any single epidemics because of the cultural or the religious beliefs. So we need to bear with them. But we also know that as part of African resilience, there are solutions because we pride this communal way of living. We praise our Ubuntu. We need to look at solutions from the community as well. It shouldn't be something being imposed upon us from others from outside of Africa. Looking at all the crises that Africa has gone through and how Africa has stand still, we should trust on some of the strength of our traditional health system and go deeper to understand how we can find the resources that will help us to overcome this crisis as well.
Perfect. Now, Dr. Asa, have we reached the peak point of the infection in Cameroon?
Joe, I think we have not yet seen the peak. Why do I say that? I say that because COVID-19 is largely asymptomatic. 80% of the people who would contract this virus would go about their lives and would never know they had anything.
Okay.
But these people may be able to infect more vulnerable people. So the numbers you see all over the net and all over social media is about testing. How much a country is testing? If you are not testing enough, you will not be able to pick these people who are asymptomatic. And even in those who actually manifest symptoms, most of them will be mild disease. They may not even need to go to the hospital. They may get a drug from the chemist and it would go. And then they may develop immunity. But during the time when they are infective, they could infect more vulnerable people. And one of the problems, or one of the things which we don't understand, like I said, it's a new virus. It's coming into Africa. It just came not too far ago. But we still need to understand how the virus moves in our population and what the dynamics are. Our population is not exactly like the population of China or the United States. We have specificities. We have malaria, we have malnutrition in children, we have people living with HIV/AIDS, we have tuberculosis.
Cough and catarrh, it's
you understand? So how would this virus interplay in this our own context? We need the data to study, look at it, to understand. But I think as we continue testing, the numbers are going to go up. It doesn't necessarily mean that the people who are tested positive are ill. The minister said in one of his tweets recently that most of them are asymptomatic.
That is, they are living ordinary lives.
Mild illness, yeah. But now, because of the risk of these people contaminating the more vulnerable parts of the population, which we have not yet clearly defined, these people need to know their status so that they can more effectively socially isolate,
okay,
so that they don't spread the disease around.
Yes.
Now, let me just come again on the point about our traditional things that people are doing.
Yes.
Let me start by saying that there is no cure so far. There are some drugs that are promising, like Prof. Ongolo has said, okay? But most of these drugs have been fast-tracked. There's no drug which has actually gone through the full rigorous scientific process to be approved as a drug to treat COVID-19. I think there's a large trial going on now, randomized control trial in New York, and once they start having results, that will be maybe the first real big trial that is properly structured. Now,
why do we not try our own selves? Because I heard the Minister of Scientific Research say the other day that chloroquine apparently has a positive effect in the treatment of the disease, and that we have structures here that can handle the mass production of chloroquine. Why can't we try and inform the West that we have succeeded in doing this on the African continent? Because. Yes,
the chloroquine story. Yes, the study from France by Professor Raoul has shown that in a few cases where he administered chloroquine, the people recovered. But chloroquine is a drug like every other drug. And in science, before you approve a drug, you should understand the full nature of the drug. What is it going to give as benefit?
But chloroquine is an old drug.
Doesn't matter, because it doesn't mean that because it's an old drug, it doesn't come with some risks. It has some risks. So if you want to roll it out for treating roll it out to treat a new disease, then you need to understand that you will not cause more harm than the good you want to do.
Okay.
Let me just add one last statement about our local remedies that people are taking. Most of these remedies that people are taking, there's no proof that it would treat COVID-19. But most of what people are consuming...
Preventive.
Most of what people are consuming now are simply things that we know. There are studies that have been done on them, and they are shown to be immune boosters, they are shown to be antioxidants, they are shown to be have anti-inflammatory properties. But we are not yet sure that they would have a specific effect on people who contract COVID-19 and have a severe form of COVID-19.
And that's the more reason why you have to go back to the laboratories to be able to prove that, like Professor Ongolo Zogo was saying. Okay.
I just wanted to add a point.
No,
there
a minute.
Are people at risk? Okay.
A minute. I'll get the online. Okay. No, you just talk because you might forget what you wanted to say.
Yes, I wanted to insist on the fact that we know at least those who are most at risk and those who are most vulnerable right now.
Okay.
Those people suffering hypertension, diabetes and other chronic conditions should pay attention. At least if they are getting out of their home, they should be using face masks. It has to be clear. At least we know that these people right now, from what we've learned from other parts of the world, there are those who are most at risk of having the more severe type of illnesses.
Okay, thank you. Teke, Elvis has just come in and he is monitoring what people are saying about what we are saying.
Yes, Joe, we go straight away to Kelvin Cham, who says to avoid COVID-19, the 4 regions affected should be completely locked down, prisons should be decongested. Tata Napoleon says there should be national prayers to pray in as much as the other measures are carried out, including a lockdown. Prince Metebomo Obese Modika says the best measure is to lock down the entire country for at least 2 to 3 weeks. While Foku Nancy Adams says the coronavirus has not restricted imagination, and they should think of giving hand sanitizers and face masks distributed free of charge to all Cameroonians. Leslie Ngwa is also saying that there should be heavy lockdown to prevent people from spreading the virus. And Roxington Ruberg says the government should specify the number of imported cases and the number of internal cases to reduce the panic in some of the population. And we'll conclude with Ami Mba, who says scientists are making a great effort to fight the virus. And what are the healthcare workers and specifically nurses doing to protect themselves with personal protective equipment? And lastly, Shea Dominic says assessing the effectiveness of the measures put in place by government is quite essential to know what is being done to actually curb the spread of the virus.
Thank you very much, Elvis.
I wanted to react on the lockdown.
Okay.
We've learned from the Ebola crisis how to manage health issues. There is guidelines for local health security or global health security issues. It's critical to build local ownership, to be able to detect, prevent, cure, and the enabling environment. The lockdown is not a panacea. The most important piece is actually to understand how the disease is spreading. The disease might vary at places and in time. So we need to have the clear understanding on the spread of the epidemics locally so that we can, because we know
take appropriate measures.
Take appropriate measure. The lockdown is not a panacea, because if we just go for locking down without science to adapt the fight, then we will destroy our whole system, and we are taking risk of a human catastrophe.
Joe, I think we need a lockdown. I think we need a lockdown. It could be a complete lockdown of the country, or those 4 regions: center, littoral, west, and southwest to a certain measure. Because one thing I know, if you're running down the street and you're confused whether to go left, right, forward, or backward, the thing to do is not to continue running, is to stop and look and look and look. I think where we are with this thing, it's so confusing. I've listened to scientists here, even yet they're not in agreement, and neither are they around the world. I think the thing to do now is for us to know, especially those who have disappeared into nature, is for us to do a lockdown and do this intensive testing and do the intensive tracing or tracking and know where they are. Let's give the 2-week incubation period to see also if there are new cases, where are they and how is their spread. I think we need a lockdown to understand what is happening.
Okay.
To say that we are searching when we are still going in the wild is very dangerous. We need a lockdown.
Yeah. Yes, thank you, Joe. I would like to react on some of the views that have been raised, especially on the points that Professor Ngola has raised here regarding those who are at high risk. I don't want the population to be scared or to be in panic because you are a diabetic patient or you have high blood pressure, and then you think that maybe you're already towards a dead point. No, it concerns everybody. It's important to insist here that this is something that cuts across everyone, irrespective of your situation, because we shouldn't dive into a situation where somebody psychologically, because you have been diagnosed in a health facility or suffering from either of the issues that he has listed, he will say, no, Professor has said over the national TV that because I'm suffering.
That these are high-risk groups.
Okay. But I want to clarify here that this is
group for severe
cases. Yes. Thank you very much. But the population needs to understand that there is nobody that is an exception.
Yeah.
And even the Minister of Public Health insist that if you must go out, try to put on a mask. But my worry also is on how the population manages this mask. It still goes again because it's not part of our culture by putting on a mask. And if you happen to put your hands or lay your hands on the virus, because it will be more preferable to stay at home, like is recommended.
But if you are going out, put on a mask.
That's why we need a lockdown. So people stay at home for 2 weeks at least. Like what he's saying. People think that because you wash your hands or because you wear gloves, I see people wear gloves and they touch things, I do not know whether it is the gloves they have to wash, or they have to remove the gloves, wash their hands and wear the gloves again. I do not, people just are doing what they are told. They don't understand the implication of what they are doing. You see people, I went to a supermarket the other day, the guy who was testing us for temperatures didn't have a mask. And when I asked him, he said the thing that I've heard sometimes the scientists say, that you only wear the mask when you suspect you are not well, or when you suspect that somebody around you is not well.
They said that.
And I asked myself, like Dr. Asa said, you can be a carrier and infect people and not be sick. Or maybe you will be sick 2 weeks afterwards, but in the meantime, you are infecting people. I think more intensive education has to be done, but we need a lockdown.
You've taken your 1 minute. Dr. Eric Tandy,
yeah, thank you.
What should not be done?
Yes, thank you very much, Joe, once again. I think a lot of information has been disseminated already in the public.
And people are getting confused.
Yes, I continue to urge the population to follow up what the CRTV is putting on their webpage and what they are disseminating in so many programs. I think we've passed so many times to explain some of these preventive measures and even the precautions taken during putting on a mask, on how to even move within the communities, and even what the Minister of Public Health has prescribed and what not about the government measures. Coming to the fact of complete lockdown, like my brother here said, but there is always an exception in certain things. And then regarding massive testing, I think that one is what the Minister has already prescribed, and it is ongoing.
Do you have the material?
Yeah, we have, the Minister cannot announce that there is going to be massive testing of the population without having the materials. If
people are moving across the region, how would you be able to carry out mass testing when people are still allowed to move around?
No, I think this is what we have in all regions. We have what we call community health workers.
Okay.
And we are working in collaboration. Even if you're moving to a particular community, you belong to a particular community. Thank you very much.
Professor Pierre Ongolozogo, what should we do? What should we not do?
What we should do is build local coalitions against COVID. The government has decided to decentralize with more responsibility on governor to organize the fight. This has to go at the community
Governors
level.
are administrators, they are not scientists. How would they do that?
Definitely, now in Cameroon you have scientists in almost all the region because we have university. We need national strategies and policy to be informed by evidence so that the strategy are adapted, are contextualized. This is what we have to do. Let's trust our ingenuity in this country and we can get over COVID-19.
Dr. Asa, what should we do? What should we not do as the epidemiologist?
I will start by saying what we should not do.
Okay.
We should not panic.
Okay.
We are going to overcome COVID-19, but it is not going to...
With everybody alive?
Not everybody alive, but it's not going to be the last pandemic. So what science and policy is trying to do now is to limit the damage. And I think it's on the good track. Some people are going to die. Some people will live. It's not the worst. Seasonal flu kills 650,000 people every year from respiratory problems.
There in Europe?
Yeah, it's still part of the world.
And the Americas?
But all over the world till now, COVID-19 has killed just, I think, about 65,000. So it's not insignificant, but we will get over COVID-19. We should be resilient. But moving forward...
So what should we do?
Moving forward, we should re-emphasize education of the population, enlisting the population as relevant participatory stakeholders in the response to COVID-19.
Thank you very much, gentlemen, for coming, and we're looking forward to having you again some other time when you'll receive the invitation. Thank you for being there for us, and we invite you to stay tuned to our programs on CRTV, if you can. Good day.